Welcome back to OBGYN Champs, where we are here with Dr. Suny Caminero, MD, of Cosmetic Gynecology of Florida, and I get to ask her all of the hot questions that women want to know, we don't know. There's a lot about women's bodies that is just, we just let it go because we have no clue what's going on.
Absolutely, completely. I
Yeah.
get questions all of the time, and women are just surprised by my answers. So I'm excited that you're going to ask me questions.
Yes. And today's theme, if there was a thesis for what we're going to talk about today, it's vaginal rejuvenation.
Yes, yes.
So let's dive right in. What does vaginal rejuvenation mean?
A number of things. So
Okay.
vaginal rejuvenation is really getting the vagina back to pre-childbirth, or kind of like rejuvenating the skin of your face. You're rejuvenating the skin of your face, you can rejuvenate the skin of the vagina.
Really?
And so there's different ways of doing it. It can be surgical, but it can also be via different technologies like laser therapy, electromagnetic therapy. There's so many different ways of doing it, but it depends on what your needs are, whether you go the machine route, the laser route, or the surgical route.
Interesting.
Mm-hmm.
And are there creams and things too that help? Or is it just, laser and surgery are like the best too?
That's actually a great question. Creams, for example, vaginal estrogen and hyaluronic acid, which are for lubricating the tissue of the vagina, actually help for women who are usually in their 40s. But before then, it really doesn't help with that, because a young woman already has estrogen in the vagina. They don't really need that. As we get older, we start to have thinner tissue. And so supplementing it with some vaginal estrogen would help significantly, not only for the vagina, but also for the bladder.
Okay.
Mm-hmm.
And so let's talk about specifically after childbirth. What does the rejuvenation process look like after having a baby?
Great. So there is a myth that women's bodies, that our vagina goes back to normal after having a baby, which is not true. The vagina just doesn't go back to normal after having a baby. And it doesn't make sense that it would. If you think about it, the muscles of the vagina, we have pelvic floor muscles, and these muscles, you have a right and a left muscle, and they're kind of hammocking your pelvic floor. And to have a baby, all of these muscles have to relax, and they have to open to allow for a 6-pound, 7-pound, 8-pound, sometimes 10-pound, sometimes 11-pound baby to come out. Well, those muscles stretch to a significant amount, and they never actually go back to normal. Now, the amount of stretch is different based on the pelvis and based on the size of the baby, but they never go back to normal. And women do notice that. And they notice it because there's some more looseness. They notice it because the bladder is now responding. They're having some urinary incontinence. And so it doesn't go back to normal. The more babies you have, the less back to normal that goes. That also applies to C-sections, believe it or not, if you've never had a vaginal baby, which a lot of people are surprised about. Because what happens is when you're pregnant, the baby is pushing on your bladder. Anybody that's been pregnant knows you get that push on the bladder. And really, the bladder is the roof of the vagina. And that pressure through the entire pregnancy is putting pressure on those muscles. And so those muscles do get affected, even if you never had a baby vaginally. Not to the extent of a vaginal delivery, but it does get affected. So the things that we typically do for a woman when we're talking about vaginal rejuvenation depends on the degree of laxity to those muscles, and depends on whether there's urinary incontinence there too. So if the degree of laxity is significant, then we have to do a surgical correction. If there's not much laxity and it's just maybe a little bladder involvement and it just needs a little tightening, then lasers work really well for that.
So let's talk about lasers. What are all the things that lasers can do to help you down there?
So lasers don't hurt. A lot of times people have this idea that a laser is
After
going to
having
hurt.
laser hair removal on my underarms, anything with a laser, I am terrified. So
Completely
this is good
different.
to know.
Completely different. There's different lasers. The main ones that are used in the vagina are CO2 laser and radiofrequency laser. And what the lasers do is that they tighten the tissue and also help you have more collagen. The more collagen, the better the tissue is. We all know that, right? If you have it in the face, more collagen, the more plumpier that skin is, thicker the skin is, similar it is for the vagina. And the lasers really, depending on the lasers, some of them it's a 5-minute procedure. Some of them is a 20-minute procedure. But at the end of the day, it really doesn't hurt. And it's just completely worth having a laser vaginal rejuvenation procedure done and really help you with your bladder and sensation and lubrication and all of that comes with that rejuvenation.
Now, do you have to shave before getting a laser procedure done?
So it depends on what you're rejuvenating, right? So if we're rejuvenating the vagina itself, which is the canal
Yes.
part where the bladder and the bottom part is where the rectum is, then you don't have to, no, you don't have to shave. If you're doing the skin, because the skin is lax, right? Now you lost some volume, the skin is kind of hanging, then it is, yes, you would have to shave so that we can get to the right areas and hit the skin right. Yes.
That's good to know.
That part can hurt, because the skin does hurt. And for that, we do numb it. You have to have it numb. Yes.
Okay.
The inside, you don't have to numb. The outside, you do.
Okay.
Yes.
So let's talk about how long the results last from vaginal rejuvenation or from the laser treatments.
From the laser treatment, typically lasts around 12 to 18 months is what you get. With surgical, this is a permanent fix. If we're doing a surgical procedure to rejuvenate either the inside or the outside, is a permanent fix. If we're doing a laser procedure, that will last about 12 months, sometimes 18 months, depending on the health of the person, really. And you can equate it to kind of if you do laser of the face. When you do laser of the face, the next 3 months, 6 months, it looks wonderful, and then you have to maintain it. And so the lasers you do have to maintain.
Okay. What are some of the physical attributes? I mean, we've talked about childbirth. We've talked about the sagging of the skin down there. What are some other attributes that someone may be like, oh, that's something I want to change?
Often hemorrhoids.
Okay.
Yes. So many women have hemorrhoids. Again, whether they've had any pregnancy at all can cause hemorrhoids, and any mode of delivery you can have hemorrhoids from just being pregnant alone. And so hemorrhoids is a big one. Many women have hemorrhoids. Many do not like the way they look. You can have some staining too, and sometimes women feel like it's not clean. They can't clean enough, and there's just some kind of staining that happens. And often they're told, just leave it alone, it's normal, it's too painful to fix it. And so they kind of live with this hemorrhoid, but they hate the hemorrhoid. And so that is something that we can actually easily fix too, and be done with that problem.
So for those who aren't familiar with hemorrhoids, it's in the rectum, right?
Yes.
There's no other place for hemorrhoids, right?
Correct.
Okay. And then what do they look like?
I call them flowers of your rectum. So they look like an ugly flower, really.
Okay.
And so the rectum, it's supposed to, they're normal to the rectum, meaning you can have them on the outside, you can have them on the inside. The ones on the outside are the ones that are not aesthetically pleasing. And also the ones on the outside are the ones that once you clean, you don't feel like you're clean because it's always stuff kind of stuck there. And they just look like bulges that come out. And sometimes they come in and out, and they sometimes they get more irritated than other times. If somebody has a lot of constipation, they come out. If somebody has a lot of diarrhea, they come out. But at the end of the day, it's more of women don't like, sometimes they're uncomfortable. Sometimes it's hard to keep that area clean because of the amount of hemorrhoids that some women may have. And also for aesthetic purposes or like for intimacy purposes, many women just don't like the way they look when they're trying to be intimate. And so that's something that can certainly be fixed.
Yes. So what's one thing that women are shocked to learn about after a treatment?
Great question. When it comes to laser vaginal rejuvenation on the inside, one of the things that they're shocked to know is all of a sudden they are not having that urinary leakage. When their cough, sneeze, laugh, like, oh, when I was doing this, when I coughed, I didn't leak myself anymore. Or when I exercised, I didn't have a drip anymore. Or if I lifted something really heavy, I didn't have a drip anymore. That's a positive. The other one is the lubrication now that comes with the lasers. Those are the two things that people notice the most. And also the urinary urgency, that have to go to the bathroom 2-3 times at night, or have to pay attention to where the bathrooms are when I go to the store because I don't know when that urge is going to come. That's one of the things that they notice changes after the CO2 laser. When it comes to a surgical procedure itself, what women do notice is, one, the incontinence often is gone, and also they can have a bowel movement normal. They
Wow.
have a different bowel movement. They just say, all of a sudden, like, I didn't know that people poop this way. I didn't know this was the right way to poop.
Wow.
It just feels better.
Oh my gosh.
Yes.
That's got to be so incredible. We do that often.
Yes.
So that's
Yes.
really a
Hopefully
life
daily,
changer.
right?
Yeah. Hopefully,
Yes.
yeah, many times a day.
Exactly. And then also when it comes to intimacy, whether it's with yourself or with your partner,
Yeah.
just having that friction makes a huge, huge difference in it when it comes to feeling. I've had so many. I'm in a field that we make a lot of. We're doing a lot of private conversations, and we laugh a lot actually.
Me too.
And one of the one of the things that make me laugh is a few times I've had some women that go, oh, when I'm having intercourse, I just go, where is he?
Oh no.
And I think, okay, now I know what you're talking about. Now
Oh,
I know
no.
exactly
The
what we
hot
need
dog
to
down
fix.
the hallway situation.
Like,
Have you
now I
heard
know
that?
yes, I've heard that. I thought, oh my gosh, now I know what we need to fix. And at
Yes.
this point, that's surgical fix,
Yes.
right? But things like that, just we take it for granted, right? In that, can we fix it? Can we not? Well, we can't fix it. Like, it doesn't have to be that way.
That's great.
Yes, yes. And you don't lose any sensation. That's the other thing that people think, that they feel like, am I going to lose my sensation? One, is it going to hurt? Am I going to lose sensation?
Yeah.
You don't lose sensation because it has to be done the correct way. If it's done the correct way, knowing the anatomy, there is no sensation loss. If anything, you gain sensation because now there's friction there to actually feel it.
Wow. What a concept for so many women who
Yeah.
are really struggling with this.
Yes, yes,
So
yes.
that's
yes,
fantastic.
yes.
Now, another side question along the lines of vaginal rejuvenation, because when some people hear that, they may be thinking yoni bath, yoni steams, those random home modalities. Are those a myth? Are those a real thing?
So they, I don't understand them very well
Yeah.
because I really don't, the vagina itself cleans itself.
Right.
It does. It has its own like
Self-cleaning
washing,
organism.
self-cleaning mechanism. It does do that. Some of those kind of home things are to bring more moisture to the area, and when you bring more moisture, then it helps it kind of clean out more, essentially. The vagina does that on its own without necessarily needing anything. The other thing too is that if you put anything in the vagina, you can actually clear out your normal bacteria that you need in there. And initially it feels better because initially you don't have whatever odor you're trying to treat or whatever it is that makes you feel cleaner. Well, now you've cleaned out all that bacteria, that normal natural flora to the vagina. And now a week or two later, you're in the same issue now. Now you're back to having a bacterial vaginosis or a yeast infection. Then you do the same thing again to clean it out. And it's like this just round and round about, and it's not fixing the problem. It's actually making the problem worse because you're getting rid of your good bacteria.
Oh, no. So what do you recommend for people in the shower? What do we wash ourselves with down there? The regular soap that we use for the whole body? Do we get a specific soap? Because sometimes those soaps are liars.
It's true. It's true. There's different thoughts in that, actually. There's a more naturalist thought that you just soap and water and that's it.
But
I'm sorry,
soap?
just water.
Okay, just water.
I meant just water. And then others, I prefer soap and water actually. But no
pH
smells,
balancing? Oh, no
like
smells?
nothing that has we don't need to have a smell or any,
Okay.
no
It
like
doesn't need to be-
lavender
yeah,
or any
the
of
flower
that. It doesn't
scent,
have to have any of that, because those things can be very irritating to the skin of the outside of the vagina. So no scented soaps. Better if it's like pH, for almost like a hypoallergenic, like things that you would buy for somebody that has allergies. That would be a better type of soap done there. But definitely nothing that it's irritating, that has tons of fumes and tons of toxic things.
Yeah.
Coconut soap works really well. It just doesn't. It's just coconut oil essentially, or
Okay.
coconut milk. It's really that works really well. And coconut has a property of being anti-yeast, so that works really well too.
Okay,
Yeah.
so would you recommend coconut oil for intercourse or no?
So that's a caveat there.
Okay.
One is you shouldn't need any lubrication for intercourse because you should be making your own lubrication, right? So you shouldn't need any. If you need any, it means that there's something going on that we need to fix so that you don't have to have any lubricant. Now, if you just got married and you're having sex 3 times a day, oh, yes, yeah. At the second, third day, you're going to need something because
Yes.
it's going to be, you're going to need some lubrication. And at that point, coconut oil actually does work really well too.
Okay.
Yes.
That's great to
All
know.
natural, cold pressed, none of this stuff that you read and has more than just coconut oil.
Oh, okay.
If that
That's
makes
good.
sense. Yes.
That's
Yes.
important to know.
Yes.
And of course, I could sit here and talk to you for hours, but our time is up today. Vaginal rejuvenation, I've learned a lot. So thank you,
Yes,
Dr.
my
Suny
pleasure.
Caminero with
Yes,
Cosmetic
thank you so
Gynecology.
much. It was great.
Yes.
It was great. I love
Yeah.
questions.
I know, it's a lot of fun. If you have questions, be sure to share them with us. We want to know. Comment on our posts on social media and let us know what you want to know from the doctor herself. We'll see you in the next episode of OBGYN Champs.
Hi, I am Dr. Suny Caminero, and I am a board-certified gynecologist in Florida and founder of Cosmetic Gynecology Florida. I opened this practice because I wanted to give women the care they deserve and be able to provide a comprehensive treatment for women in one location. Here in Cosmetic Gynecology, we really focus on the topics that women are embarrassed to talk about. It's the things that affect women on how they feel in their body, how they function, how they have their relationship, their self-esteem, and the things that are blocking them from being the best self that they can be. Anything that has to do with their vagina, with their labia, with their clitoris, all of those things are really hush-hush, and women are not encouraged to talk about, and also they're embarrassed to talk about it. Urinary incontinence, hormonal imbalance, just not feeling comfortable in your own body. These are the issues that we want to solve. Over the years, I have obtained specialized training to be able to provide care for women in the different aspects that affect their individual parts as well as the whole part. We have curated this entire experience to give you the solutions and the results that you deserve. From the moment you walk in through this door, it is a safe environment. It is a calm setting. What we want is for you to feel comfortable to discuss anything with us. When you're completely comfortable talking about what's going on, we can give you real answers. Everything that we do in this office is thoughtful, it's private, and it's centered around you. There is no pressure, there is no judgment, there is just real solutions. Because your quality of life is not an option. Expect more from your body, and we are here to help you live your best life.
And be sure to tune in for the next episode as we talk all about what it's like to have sex after having babies.